If you're just joining us, I see that we have 55 attendees, and we are giving a couple more minutes for everyone who wants to log on and join us for this health fair hosted by the San Mateo Daily Journal. Looking forward to lots of great presentations and a wonderful discussion today about health, about San Mateo County, about what's available to all of us and what we should all be doing. I see lots of people joining us. There are 58 attendees, quite a few panelists. I'm going to give a few more minutes for people to log on and join us.
Hey there.
As I just mentioned, this is being produced by the San Mateo Daily Journal, celebrating their 20-year anniversary. We are so fortunate and really lucky to have such a great paper informing us about events going on at City Hall and really everywhere. In an era when local newspapers are struggling, we're truly blessed to have the San Mateo Daily Journal here in San Mateo County. One of the other things that the Daily Journal does is they host events just like this, our health fair, they have a job fair. There's a number of other events that they help to sponsor and support. And just like the rest of us, where my kids are going to school on Zoom, the Daily Journal has, over the last few years, made the excellent transition to the internet. The digital version of the Daily Journal is fantastic. It's also another great opportunity for people who want to advertise or provide sponsorships to do that with the online version of the Daily Journal. Today's health fair will cover the gamut of health, from COVID to staying healthy at home, mental health, volunteering, and having a healthy planet. We have 11 local nonprofit organizations presenting today, and we thank each and every one of them for their support. Our exhibitors today are going to include Kaminar, Actera, Anthem, the Center for Independence of Individuals with Disabilities, SF Hep B Free, HIP Housing, Stanford Patient Experience, California Relay, Meraki Real Estate, Peninsula Family Service, the Ombudsman Services of San Mateo County. And today you will get to learn about each of these organizations, what they do, how to contact and support them, and how they contribute to our healthy community. Our presenting speaker will be Bill Graham, president of Dignity Health Sequoia Hospital. And we thank Mr. Graham for joining us. He will speak at around 10:20. My name is Joe Goethals. I am the mayor of San Mateo. For many of you, I am your mayor. I have lived my whole life in San Mateo. I was born and raised here. I went to Santa Clara University, where I studied microbiology. I was an emergency medical technician, so I provided EMT services. I did research at Santa Clara, research in public health, and then got my master's degree in public health. A few years went by, and then I came back and served on the Peninsula Healthcare District Board of Directors. Again, serving our district, our community, and making sure that we have everything that we need when it comes to public health and public health services. I'm looking now, and it seems that we have about 81 attendees. Great to see everyone here. Thank you for joining us this morning. If you're just joining us, again, this is the Health Fair hosted by the San Mateo Daily Journal. We are all fortunate to be here, and we have a number of speakers from different nonprofit organizations here in San Mateo County, and we're talking about health this morning, getting ready for our first presentation by Kaminar. Our first presentation is by Kaminar, and the CEO will present 6 ways to stay emotionally healthy and improve immune functioning during uncertain times. That will be our first presentation. Welcome, everyone. We're over 100 participants at this point. Thank you all for joining us. If you want to chime in the chat, please feel free. I see some people are already chatting. You can also raise your hand, and you can ask questions. Mark, thank you for joining us.
My pleasure.
And we are looking forward to your presentation. Kaminar is such an important part of our community, and we appreciate everything that you do. Thanks for joining us this morning.
Thank you for inviting me. And I want to thank the San Mateo Daily Journal for sponsoring this. And Mayor, I did not know you had a public health background. So clearly that's great preparation for this time that we're in. I want to take a few minutes to talk about what we've been in actually for the last 6 months, what it has been to be in shelter in place, and then shelter in place in which we're pulsing back and forth. Okay, I'm getting, let me adjust my camera. I just got pulsing back and forth between opening, and I'll just give an example of how I've experienced. We were obviously in shelter in place through the beginning of the pandemic, and then some things opened up here in San Mateo. We were able to open up gyms, and I was able to go to the gym, and then it closed down. And I'm referencing that in that all the things that are opening and closing and pulsing are things that may allow us to pursue our health, our mental health, be connected to people, participate in community, be able to go to your faith congregation. All of those things are really important facets of maintaining healthy mental health. And in the face of all of that being restricted, people have had a variety of emotions. Some of them are anxiety, anger, depression. We know in particular that anxiety disorders and depression, people are reporting in surveys that that's up about 10%. People have a continued, I would say this is particularly true of seniors, sense of isolation. People experience agitation, numbness, and then there's multiple feelings that you can identify. And then there are symptoms that are showing up like loss of appetite or extreme appetite. A lot of people are experiencing changes in their sleep pattern. Many people are experiencing insomnia. And all of those are normal. Those are all normal to be going through a period like this. And you may cycle through all of them in one day. All of those emotions, all of those symptoms may be still occurring daily. And then if you have children, you have multiple challenges because obviously many parents are now trying to work from home and spend 4, 5, 6 hours a day teaching their children. And so I want to focus on children for a minute here because that's really, in some ways, children and adolescents are the group that are experiencing probably the most, I would say this in a very measured way, but harm from the situation that we're in. And in particular, I think for kids, adults can talk about what we're feeling, our isolation, our sense of being cut off from our family and friends. But kids have difficulty expressing their emotions because in some ways there's a very crude way in which they do that, but for the more complicated ones, that may be difficult. So I think this is really an important time for parents to check in with their kids and maybe even model what some of the difficult feelings are. For instance, someone saying, I miss seeing grandpa. How are you doing? what are you feeling as a way of getting their kids to express what's going on with them? And then I want to talk about adolescence for a second also, and that this period developmentally is such a critical time for adolescents to be around their peers. This is the time where we all understand adolescents are developing an independent identity separate from their parents and need to be not just through social media, but in physical proximity, being able to talk to their friends, exchange feelings with their friends, talk about what they're facing in life with their friends. And by not having a lot of physical proximity, that makes that much more complicated. So I also want to acknowledge too that from the literature, there's a short-term effect of quarantine, and then there's a longer-term effect. And in the mental health literature, it suggests that actually when we're going through a period like this, that people often have shorter-term symptoms that after a year turn into longer-term symptoms. And those in particular are anxiety and depression. So this is a time, if you're feeling any of those, or changes in your sleep pattern, changes in your use of alcohol or drugs, to think about reaching out to a professional, because we know a vaccine may still be 3, 4, 6 months away, and that we're in this kind of emotional environment for the short-term foreseeable future. So I want to talk about what you can do to take care of yourself during this time, that there are things that we can all do to improve our mental health and to improve our immune functioning. And why I'm mentioning the immune functioning is we know that if your immune system is stronger when you get exposed to COVID-19, you may not get infected, or you may have a less severe course of infection in terms of the presentation of symptoms. So here's my 6 things that I want to recommend everyone consider doing every day. One is supportive relationships. It's very important for you to be in contact with your family and your friends, be it through social distancing events in your backyard, through FaceTime. This is an important time to reinforce and appreciate the bonds that you have and to express gratitude to the people in your life. That will improve your sense of reducing your anxiety and your sense of isolation. The other thing that's very important to do is to exercise 60 minutes a day. I know that may seem hard, so maybe just start with 30 minutes a day. We know that the effects of that on your immune system, as well as your endocrinological system, of making you feel more optimistic, making you feel more hopeful, is clearly related to exercise of 30 to 60 minutes a day. Healthy sleeping is really important now too. I know a lot of people are experiencing versions of insomnia. You should improve your sleep environment by making the room that you sleep in dark and quiet. Don't look at screens for 2 hours before, and to try and get 7 to 9 hours of sleep. Nutrition is also very important. I know this is a time where a lot of people may be tempted to have that pint of ice cream, maybe drawn to comfort food. I know for me, my draw is the tortilla chips. I can eat a huge bag of tortilla chips, and this is a time to stay focused on, we know what serves your body well in terms of nutrition. Lean meats, fish, legumes, vegetables, fruits, whole grains. Concentrate on improving your diet as a way of stabilizing your blood sugar and improving your body's ability to fight off infections. Then there's mental health support, as I mentioned earlier. Do not hesitate if the symptoms are lasting longer than usual. If you are feeling severely isolated, if you've lost hope, if you are having difficulty sleeping, if you're finding yourself drinking too many glasses of wine or alcohol, this is a time to reach out to a mental health professional. And lastly, mindfulness. Fortunately, in the Bay Area, we have a great culture of mindfulness that's come to our workplaces and to our schools, we need to make sure that we bring it home. So 20 minutes a day of focusing on your breath, or if you're a member of a faith community, praying, any way in which you can still your mind and focus on your breathing for 20 minutes is certain to improve your endocrinological functioning and will bring you a sense of peace and help you restore your immune functioning. So those are the top 6 things that I recommend. And be realistic about the future. You know, I think we all go through periods where we're wildly optimistic, where there may be a news article about the success of vaccine trials. Even with the vaccine and treatment, we know that the long-term economic effects will be significant. So we know that when the pandemic, so in that sense, continue to practice these health behaviors, focus on the present, and find gratitude for what you have now. So with that, I want to thank you again, Mayor, for sponsoring this, and for the San Mateo Daily Journal for arranging this for us all.
Mark, that was absolutely fantastic. Thank you so much for those 6 things that are not only good during a pandemic and during 2020, which has been an absolutely crazy year, but those are great pieces of advice for all time. You weren't at my house last night. You didn't see the tortilla chips that we were.
No, but they would be gone if I was there immediately. So, yeah.
I don't know that we left any for you. So
Okay.
it's something that we have to strive for every day, the exercise, the mindfulness, the gratitude. Great pieces of advice. Are you over at your offices on 25th right now?
I am, yes. And we're
That's
open.
fantastic.
So we're seeing clients here. So please feel to reach out to us.
You have been such a great partner to the community. We love everything that Kamenar does. Mark, thank you for being with us here today. It was a pleasure, and I have all of them written down. We'll go back to those 6 things, I'm sure.
Thanks, Mayor Goodalls. Thank you very much.
Take care. It was my pleasure. And now, before we get to our keynote speaker, I want to invite in, I believe we have former Mayor Diane Pappin joining us. Is Diane, do I see you? I'm looking. Give me just a second. If I don't have Diane yet, I'll go to Amarance Lee, Councilmember Amarance Lee. There you are, and you're unmuted. Mark, the CEO of Kamenar, was just mentioning that we're lucky in San Mateo because the City Council has a public health background, and that applies to you too. Tell me about your public health background.
Good to see you, Mayor. Yes, I studied public health at Columbia University while I was getting my master's in international affairs, and I spent a good deal of time up in the medical campus in New York City. And while I was actually studying, I served as a bilingual case manager in Chinatown, serving people living with HIV and AIDS and advocating for their services and needs at an individual basis. It's very powerful work, like when Kamenar does case management, and you get to know people's lives on a very intimate level. You get to meet their family members, see where they live and work, and have a real window into community need through individual lives.
That's wonderful, and you did that work for many years. The one-on-one work of making that impact in people's lives. And you're still doing that today as a council member.
It's true. and so much more relevant skill than I ever imagined in this position. It didn't seem that important to have a public health background until recently.
But then 2020 hits, and I think San Mateo residents are just glad that they had the right people in place for a year like this, a year where we're not only facing a pandemic and a
Heat
recession,
wave.
a heat wave, the rolling blackouts, all of those things. But we've got the worst fire year in California history. Wildfires over 2 million acres at this point, and people, it's not top of mind because there's an election going on and there's the pandemic, but air quality is such a huge issue for our health as well. So it's a good time to have people in place who understand public health and who really care about the community. Let me
And
see
we
if we
probably
also
wanted
have,
to mention, we have cooling
please.
stations at the senior center today. I'm sure Samantha and Drew would want us to mention that.
Absolutely. So as we continue to face these high temperatures, we want people to know that there is sanctuary for those who can't get out of the heat in their home. Come to the senior center for the cooling stations, and we welcome you there. Thank you so much for the conversation. I might invite you back later on during the health fair. I'm going to try to get Diane on next as soon as I can find her. We'll get back to her, but first, we now have, it's now time. We have over 100 participants who have joined us, and this is the moment that I think people have been waiting for. We now present Bill Graham. He is the president of the Dignity Health Sequoia Hospital. He is here to discuss COVID and the community. Let me see. So there you are. Excellent.
Good morning.
Welcome. Good morning. Thank you for everything that Dignity Health does for our community. Thank you for being with us this morning. Thank you for sharing your thoughts with our community, and welcome.
Yeah, thank you. I'm very happy to. And thank you, Mark, for your comments. I think that we started off with a discussion around mental health is really critical. I think that this has been a very, very challenging year. We don't use the term unprecedented anymore, but really just with so many things going on. I think it really does put quite a bit of strain on us. I'll share that I had my scoop of ice cream last night and enjoyed that, and the tortilla chips sound pretty good too. So I'm glad to know we all have our things. I do want to thank the Daily Journal for hosting this and also acknowledge the panel. I think that hospitals have been front and center for some time as we have addressed the COVID pandemic. But really, it's about community. And I hope that in my comments, even as I talk about the hospital and what we have faced in these recent months, that it will be clear that much of what we have done has been through the help and support of our community. So I have some slides that I'm going to share. And are those coming through for you?
That's great. We can see them.
You should have one that says COVID-19, our community.
Yes, we see the whole screen, so we see the next few screens as well.
Okay, I will put it on presentation mode. And does that give you the presentation? I'm gonna flip.
It's mirroring your screen.
Okay, you're getting the whole piece of it, it looks like. Let me stop and try one more thing.
No problem. Well, you figured that out. I want to mention that your contributions to Sequoia span the entire breadth of the hospital services, from securing dedicated funding and infrastructure for the Heart and Vascular Institute to leading the development of a cardiovascular co-management program, aligning 3 distinct physician groups, to co-leading the effort to secure $15 million in funding to reopen a closed peri-operative suite.
Okay, we'll go ahead and we'll just go ahead with it, the presentation. You probably get to or see a little bit more of it or preview the slides, but that's okay. I will go through it. So let me just talk a little bit about me very, very briefly, only from the context of sharing that I also have a undergraduate degree from Santa Clara University. So nice to know that we've got another.
Go Broncos.
Yeah, go Broncos. I'm a member of San Mateo. I live in the city of San Mateo, so I am appreciative of all the work that you and others do. And I have a master's degree in public health from San Jose State University. Just the reflection on public health, the thing I will say is that, oftentimes we talk about the fancy and the exciting things that happen in medicine. But when those things aren't there for us or they're not ready for us yet, one of the things that we know is we can go back to the fundamentals of public health. And what we're seeing today, the shelter in place, some of the other work that's happening is very much fundamentals of public health. So it's time for us to recognize and appreciate everybody who has that background and how that is really deployed and used in so many different ways. Just a little bit about Sequoia Hospital. We are located at 170 Alameda de las Pulgas. So we're in the corner of Whipple and Alameda, and we're a little bit hard to see from the road. We've got beautiful Sequoia redwoods to keep the view pretty from the street, but this is a picture of the hospital looking at the front entrance and our pavilion and the rooms of the facility. We're an accredited not-for-profit hospital. We provide innovative, exceptional care to residents of the Bay Area. And we were founded in 1950. And our founding story is, I think, a really interesting story of 9 women in Redwood City who in the 30s decided that this was an area that was growing. If you see some of the pictures from that time, there were still a lot of fields and open fields. Can you guys see my slides?
Not yet. Try it again.
Okay, let's try it again. I just got a text that you're not seeing those.
Sorry, Bill.
Okay, how about now?
Yep, there it is. Thank you.
Okay. Just move it to the. Women who founded the hospital, 9 women in the 1930s, they were interrupted by World War II, but they didn't give up. And I think that the story with them is that they were truly committed to ensuring that we had strong healthcare on the peninsula. As I was sharing, that this area at that time was still a lot of open fields, and actually the land that the hospital is on was a cow pasture. And the neighborhood around us was just beginning to form, but they could see that the need was going to be there. And so we opened in 1950. We were the first district hospital. If you think of a district, it's a lot like a school district, but it was dedicated to the support and funding of the hospital. In 1996, the district chose to exit management of the hospital. It was a time where being a solo independent hospital was becoming more difficult, and the district felt that it was better to align with a larger organization, which resulted in the hospital joining Catholic Healthcare West, which is now Dignity Health, part of Common Spirit Health. And that's been a wonderful relationship for us. It really has provided enormous support, and I think you'll see that a little bit in the presentation. The Sequoia Healthcare District still remains. It's a very viable entity and also doing a lot of really phenomenal work in our community, and has been very active in the support of the COVID response in our community. A couple things about us just in terms of the quality of care, and then we'll move on to COVID. We are recognized by U.S. News and World Report as a leading hospital in the Bay Area. We are the 5th best hospital in their ranks, or ranked number 5 in their ranking for the San Francisco area. We are consistently a 5-star rated hospital with CMS. We're regularly voted as a family favorite for Bay Area Parent, and receive multiple awards for the care that we provide at Sequoia. We're particularly known for our Heart and Vascular Institute, as well as our birth center and our total joint replacement center. And we've got strong relationships with both Stanford Children's Care and UCSF Health. So let's talk about COVID, and I'm going to just ground us a little bit in some data. These are all pieces of information that are available through public sources, but I think the emphasis of this slide is that COVID is a very active disease across the United States. It's more active in some areas than others. The darker shades of orange represent the areas that have seen the most activity, but you really can't go anywhere in the United States at this point and feel that you are free of it. And what we're seeing actually is that there were places that saw an early impact and now places that maybe were shielded from it early on that are starting to see more of an impact. There's over 6 million cases in the United States, really almost 200,000 deaths, and that's before we are even entering into what we think is going to be particularly heightened time for the disease as we go into the fall, knowing that respiratory diseases oftentimes will ramp up in the fall and winter. In California, similar situation. We've got almost or a little over 700,000 cases. We've had 13,000, almost 14,000 fatalities. We've got large numbers of people who are hospitalized and large numbers of people who are suspected of having the disease, but haven't yet had their positive testing coming back. In the state, it's a little bit more skewed towards women than men who are diagnosed. And we're seeing with the age that the 18 to 49 age group is one where the disease is probably seeing the greatest increase right now. If we look at San Mateo County, we've had 8,600 cases. They've been split roughly between males and females. Again, you'll see the age distribution is skewed towards that 20 to 40 category. That was not always the case. Early on, the disease seemed to be skewed towards a much older population. I think we saw that reflected in the outbreaks that we had in many of our assisted living facilities and skilled nursing facilities. We've had 135 deaths, and it's been fairly equally distributed. And not surprisingly, the deaths are predominantly in the older population, older adult population. I think the thing that's probably most concerning on this slide, and I will spend some time on it a little bit later, is the cases by race and ethnicity. And you'll see that the Latino Hispanic population has been hit particularly hard. So we'll talk about that. A lot of that is because that is a community that is oftentimes essential workers. So they are working while others are sheltering in place and working in environments that may not provide them with the same levels of protection that we would want to protect them from the disease. This is hospital data. And what I'll share here is that we currently have 36 patients hospitalized. These numbers have gone down, and you can see it in the data over recent weeks. And so we have seen some ups and downs of hospitalization. Right now, 36 is a very manageable number for the resources that we have in San Mateo County. And I would say that our hospitals overall have done a really phenomenal job providing care, and we have not been impacted probably the way other hospitals and other communities have had. And you'll see a box at the upper right-hand side where it says out-of-county patients. One of the things that is different with COVID is that there is a lot of state and county management of where patients are, and particularly when communities are overwhelmed. It's not unusual to see cases being transported out of those communities. And we actually had an example here, and we know it was across Northern California, where parts of Southern California were so impacted that there were cases coming from Southern California all the way up to Northern California for their care. And so I think that coordination has been important. I think it's been a way in which the state of California has done a good job of trying to match resources to the demand in different communities. And let me talk a little bit about the experience from our perspective. And it really began for us back in March. We were hearing about COVID-19 for a little bit. We'd been doing some planning around it. We'd been working closely with the county in their planning efforts. And we have systems and structures in place for how we deal with these types of events. But until it happens, I don't know that you always have quite the urgency behind it. And I think back in March, the thing that was very, very clear is we didn't know what we were dealing with. This was something that was very new. And it was something that we were kind of learning every day. And there was a lot of activity around that. And I'll say the resiliency of so many people to innovate, to change, to try new things was critical back then. The virus didn't hit California first. We had examples of Seattle, New York, Italy, other communities. Fortunately, as I shared, it didn't hit us as hard as others, but we were already early on beginning to try to capture PPE. We ended up pausing elective surgeries. This was consistent throughout much of the country. And I think the concern we all had at that time was that if we are full, essentially, with people who have had surgeries and other procedures at our hospitals, and we can't accommodate a wave of people coming in with COVID-19, it could put those patients as well as the hospitals in a very vulnerable position. So we saw hospitals all over the country really making the decision, very difficult decision, to ask patients to hold their care. And generally we were saying if it can wait for 30 days, 45 days, that's what we're asking people to do. To Mark's comments, resiliency and staying healthy mentally was a part of all of this. And I think humor sometimes was one of the best ways in which we did that. And the cartoon, for those of you who can see it, says, "Until now, I understand why you got so excited when somebody walked past the house." I'll say I have a dog that anytime somebody walks by, mask or not, is barking more than we would like her to. But when we did the shelter in place, that was nothing that any of us had ever experienced before. And I can say, as somebody who was working during that time, going back and forth from my home to the hospital, and that was really my path of travel, it was very, very strange to have so few people out. And what I can only say is thank you to the community for the commitment to that, because as strange and as difficult as it was, it made a huge difference. And it was probably a matter of weeks. Had we done it later, I don't know that it would have had the same impact. And the leadership of our county health organizations and the collaboration among our county health organizations was critical, I think, in helping stem the disease in this county. But we do know that there was a downside for people who had other health conditions. And so we all have seen and continue to see much less or far fewer patients in our emergency rooms than we are used to seeing. And the patients that we're not seeing are patients that are typically people who have heart attacks or strokes or severe disease. This is not as much about the urgent care business that might be going someplace else or using other technologies. So that has been a concern. And we also know that people delaying their care is challenging, and things that were elective in March were becoming more urgent and more important for people to have resolved. So we began reopening our hospital in May, very similar timeline to many other hospitals here on the peninsula, ensuring that we were a hospital that was caring for all patients, not just a hospital that was caring primarily for COVID patients. And as I said, the hospitals here were not overwhelmed. We had the capacity and the ability, all of us, to expand the care that we were providing. But we're all doing it in ways that are ensuring the safety of patients. And I'll say that the hospitals, the CEOs of the hospitals meet once a week. We talk together. The county leadership from county health are part of that conversation. And the guidelines that we're following, they come from the CDC and CDPH and our local public health. But we're trying to be very consistent in how we do this, because we want the experience of residents of this county and patients who are coming to our facilities to know that they can expect very similar things regardless of which hospital they're going to. Maybe the most difficult is the fact that we are limiting visitors. And that is to protect our staff, it's to protect our patients, and to protect our visitors. But we know that that is very, very challenging. And so we continue to look for ways in which we can work with our families, our patients, to ensure that they're getting the appropriate communication. In our birth center, all of our moms have a birth partner, and we ensure that that is supported. And for certain circumstances like end of life or other very critical situations, we're making sure that people are well supported. We're following all of the same social distancing guidelines in the hospital as you would expect outside the hospital. And like outside the hospital, it can be challenging. We just forget sometimes, and this is not an environment where we can forget. And so it's a reminder that we have to be as diligent within the hospital as we are outside, and a reminder to those of us outside, always being diligent with our masking, et cetera. Just to acknowledge the community again, we received tremendous support. All of the hospitals did. When people learned that we were struggling with the personal protective equipment, the PPE, the donations just flooded from everywhere, and it was amazing the support that we got. Number of restaurants provided meals. Our local chamber, Redwood City Chamber of Commerce, established a program to support our local restaurants to help keep them busy while also providing food for our caregivers. A lot of letters of support. And one of my favorites, we had a girl in our community who did hand-painted thank you notes, over 500 of them, and sent them to us to distribute to our staff. And people were, they appreciated all of the things that came in. I think that was one of the ones that was probably most impactful. And it says in this cartoon, again, for those who can see it, when I was a kid, I wanted to be a superhero. And the other person saying, and you became one. And I think our people really did demonstrate their commitment. And whether or not you were a doctor, a nurse, a person who is responsible for cleaning the rooms, that's our first line of defense against infection. People really stepped up, and they really found ways in which they could help support the work at the hospital. So quickly, just what can you do? I've become a little bit of a I don't know, policeman on masks, but and we always want to be appropriate in the guidance we're providing people, and how we do it. But masking is critical, but it's also important that we wear our masks the correct way. So this golden retriever has provided some good examples of how not to wear a mask and how to wear it properly. So we appreciate all the support, and we know that the masks are difficult and inconvenient. San Mateo County residents have done a very good job with it, and so just the continued diligence is very much appreciated. The guidance, again, from CDC, stay home, wash your hands. Hand washing is very critical. Continue to maintain your social distancing and your masking. Cover your nose and mouth with your mask. And really monitor your daily health. This is a time to be aware of how you feel, and if you're not feeling right, seeking the appropriate attention. Seek medical care, take care of yourself, stay in touch with your doctor. Just because you have this disease doesn't necessarily mean you need to be in a hospital, but you do want to stay connected with your caregivers. I think that is particularly important. And then if you do have a diagnosis or you have certain conditions that are of concern, it is important to seek care either through the emergency room or through your care provider, particularly if you have trouble breathing, persistent pain or pressure in your chest, confusion, inability to wake up, stay awake. There's a lot of other symptoms that people have experienced, but if you're really not feeling right, we strongly encourage you to seek care. Because if you have this disease and it is progressing quickly, we know that many people do well with it and don't need supportive care, but when you do need supportive care, it can be critical that you get that early. I mentioned the Hispanic Latinx community, and just a couple comments on there. On that again, we know that communities of color are disproportionately impacted across the country with COVID-19. And we know that in San Mateo County, the data show us that the Latinx community is hospitalized at greater rates and is diagnosed at greater rates. And for those of us that do come from a public health background, we know that the health of our overall community is absolutely critical to the health of everyone in the community. And so we need to continue to make sure that the Latinx community, particularly those who are working in essential jobs, they are providing the support that is necessary for our county to continue to do business and to expand what we're able to do, that they are supported. So we have a number of resources. There are health fairs that are being planned. We'll be a part of some of that work, but strongly encourage, especially the organizations I know who are a part of this panel, doing some phenomenal work, that work continue. And then there are opportunities for you to volunteer in safe ways throughout the county. And the commitment that we have made is that we will continue to provide, as will the other hospitals in San Mateo County, the exceptional care that we've all been known for, and that this county so well deserves. And again, the final note on testing. I know that testing has been something that we've all struggled with. I'll say the testing resources continue to be challenging. We are testing the majority of patients that come into the facility, but don't have a lot of capacity to test beyond that. Our organization, Common Spirit Health, is developing expanded test capabilities through a large lab in Arizona that's opening this month. So we're excited about that. But I think testing will continue to be a challenge for us. So there are locations, I've listed a couple through the Go Health Bay Area urgent care centers that are affiliated with us. But the county also has information on testing sites and how you can have access to testing services if you need them. And then just a couple final last cartoons to keep some of the humor behind it. For those of us that have kids who are learning online, I think the one mom's upset because she got an 82 on my science test. I hope that's not the experience of many, but I know that there are many challenges just community-wide, and all of us are learning, and the ability to support each other and to manage through that and take advantage of services to help us through it is critical. And with that, I will stop and ask if there are any questions.
Bill, that was an absolutely fantastic presentation. Thank you so much for that. I do want to feed you a couple of the questions that I've seen coming in, and we can keep the camera on you so you can answer them. How was preparation different? I think we all saw the Ebola scare, and I saw hospital preparing for something like an Ebola outbreak. But it seemed like the PPE involved in that was so intense that we never could have had a response at the same scale as we're seeing COVID to something like that. How has the preparation for COVID been different from things that we've seen in the past?
I think the thing maybe that was different was the large scale impact of it. If I reflect back on Ebola, although it's a very scary and terrifying disease, the incidence of transmission is much more difficult. And so while we worried about it and did extensive planning on how to manage it, and in many respects, how you wear the PPE and the complexity of that was much greater, I don't know that it raised quite the same alarm simply because it was probably not expected that as many people might be impacted. The challenge we saw with COVID was that it was having such a dramatic impact and so many people all at once in certain communities. And I think one of the things that we've learned is that we got used to just-in-time strategies around things like PPE. So, through the miracles of modern transportation and computerized ordering, we could be managing inventory from all around the world very quickly and have access. And a lot of that broke down as China was impacted. A lot of PPE was coming out of China, and systems were probably not as resilient as we had hoped they would be. So I think most of us now are really looking at, especially as we go into the fall and winter, how we are building up our capacity around PPE. We're working with new suppliers, and we're keeping much more on hand than we probably would have previously.
To draw one more analogy, we have the Spanish flu to learn a lesson from. It lasted a few years, and is now the time to really dig in and get used to a new normal and make sure that we're taking care of ourselves, because this may last for a while.
Yeah, I think we do have to plan on it being here for a while, and I think the Spanish flu does provide many representative examples, whether or not it's about things like masking and what happens when you stop doing that too soon, or the preparation. I think it is part of our community. It is a very significant, severe respiratory illness. It will probably follow the path of other respiratory illnesses, and we'll see peaks during the fall and the winter. I'm hopeful for a vaccine. It's not an area of expertise for me. I think that may be something ultimately that is different than the Spanish flu. But until we have a vaccine, I think our best resources are to know that it's here, to understand it, and to follow the guidance of the health professionals.
I want to mention a couple of other things. So two of my daughters were born at Sequoia. We absolutely loved our experience. So thank you so much for having such an amazing, great hospital here in our community. You and I share master's degrees in public health from San Jose State. I'm sure you have fond memories of Dr. Kathy Rowe and the entire staff down there.
Very much so, yeah.
One of the best experiences of my life, and really great training for everything that I have done since then.
Yeah, it was a really, really wonderful program. And, just reflecting back, I was there probably a few years before you, but many of the students I was there with, this was in the early 90s, and so AIDS was still ravishing communities. And so many of the students were there because of that, and it just really highlighted that without, drugs and some of the modern medical interventions, the tools and resources that we have through public health and through education are vital. And I think we're seeing that again today.
Absolutely. And I want to highlight one more thing that you mentioned today, which is the racial disparities, the comorbidities, the fact that you highlight that we're trying to address it, that we're making sure that all communities, especially the Latinx community, have 100% access to healthcare and health insurance is such an important part of fighting this disease and really building positive community health.
Yeah, and then, through the county, I would say anybody, regardless of ethnicity, but if anybody feels that they don't have access to health, they don't have insurance, there are a number of different options, either through Health Plan of San Mateo, which is our Medi-Cal provider, or other options. But this county has done a phenomenal job to ensure that people have access to care. So, we encourage everybody and anybody, and certainly the hospitals will help do that, make sure that you are taking advantage of those resources.
Bill, if you don't mind, we had one more question just come through, and I'd like you to address it. So the question basically is asking to address whether the numbers are reliable. The numbers that we see in terms of COVID deaths, is that reliable? Are people just counting something as a COVID death without doing any testing? I think in the community we see these opposing forces. On the one hand, we want to keep the numbers as low as possible so that we can open up because we know the economy is critical. And on the other hand, we want to make sure that we're not undercounting because it's critical to our public health response to make sure that we know where the disease is. Can you address that a little bit?
Yeah, let me try to do it and to keep it within just a few minutes. I'd say overall, yes, the test or the data are reliable. Now, there are always challenges with that. We know that the state had some reporting challenges. I think that's been resolved. And I think what can get missed is deaths that maybe are occurring outside of a hospital environment and where it may not be as apparent. But I know that, you know, the protocols are pretty standard. If we have a death in a hospital and how that is determined and how it's defined is pretty straightforward. We're not doing anything different than we might otherwise have. There are certainly other comorbidities or health issues and challenges that people may have. But I think if we're identifying that somebody died as a result of the COVID-19 virus, I think that's a pretty reliable statement.
Excellent. Thank you so much for your time this morning. Thank you for supporting the Daily Journal and this health fair. Thank you for having such an amazing hospital in our community and everything you do to maintain the health of our community. Bill, we appreciate it and we salute you and Dignity Health.
Thank you. I appreciate you all taking the time.
Be well.
You too.
At this point, I'm going to invite in my colleague, Diane Pappin, who is the former mayor and council member, for just a minute to say hello. Diane, are you there?
I'm here. Good morning. Can you hear me?
I can hear you. Thank you so much. I've seen all of your tweets reminding people about the heat wave and about the cooling centers and about the education hubs that we have in North Central at the King Center. But many people don't know that you're also an executive director of a nonprofit. And so making sure that people are served and that you're serving their needs is an important part of your role in our community. Thank you so much for that.
Thank you. Thank you so much, Mayor. It's an honor to be here this morning. What a great program. So much important information that's coming out. And I think one of the things I'd hit on, as you know, what we deal with a lot as city council members is we spend a lot of time on how are we going to keep people safe. And that really includes interpreting and enforcing or doing what we can with respect to health orders that come our way, whether it's parks, playgrounds, business districts, our own city buildings. We're really working hard, and I'd like people to know out there that we do the best we can with the information we're given at the time. We also do a lot of disseminating of information as to where those orders stand at any given time, which is really, I think, the key role that the city is playing here. Because we do, like you said, we want to make it where people can enjoy their lives as much as possible, but still stay safe. So I really appreciate this program. I appreciate not only the previous presentation, but the mental health emphasis. There's a boatload of mint chip that got eaten last night.
It's okay. It's okay.
I'm forgiven.
Yes.
But thank you to the Daily Journal. Thank you to Sequoia. I'm getting so much out of it, and I'm just delighted to be here with you this morning.
Excellent. Thank you so much, former mayor, council member Diane Pappin, and thank you for all the different roles that you play. You serve on these regional boards that represent us, not to mention all the hours you put in as a council member. These are tough times on all council members, and we're doing everything we can to, as you said, make the best decisions based on the information we have and disseminate that information. You are truly one of the great ones. Thank you so much.
Thanks for mentioning my nonprofit too.
Thank you, Diane.
It's near and dear to me. See you later.
Bye. See you soon. You got it. All right. We have our next presentation is coming to us from Actera, and I am looking for. There you are, Lauren. Lauren, welcome. Lauren Weston, Executive Director at Actera. Thank you for joining us this morning. We're so looking forward to your presentation. It's been a great health fair so far. We want to thank our host once again, the Daily Journal, for putting this all together. And I'm going to turn it right over to you. Thank you, Lauren, for joining us this morning.
Thank you so much, Mayor. I'm Lauren Weston, the Executive Director of Actera, and I am in amazing company today. So I'm so grateful to be here. What a wonderful presentation from Mr. Graham. Thank you so much to the Daily Journal. I'm going to screen share a couple of slides, and I'm hoping we can recover some time on my part. I will make this as quick as possible. Okay. Actera's mission is to bring people together to create local solutions for a healthy planet. And we have seen time and again over these last few years in particular, how closely climate, extreme weather is related to people's health. We spent the last year doing a strategic planning initiative that highlighted new key areas for programming for Actera, ways that we could delve into our local communities, particularly with frontline communities. And one of those key things is food, and which I'll talk a little bit about, and the other is beneficial electrification. We of course still do education programming. We do a lot of clean energy programming. We house other organizations that don't yet have their 501c3 status, and we help them, build and innovate their programming to the point that they can grow into their own nonprofits. But for today's purposes, we'll focus on these two key areas. A little bit of background with Actera. We're 50 years old. We're celebrating our 50th year this year. We were born on Earth Day, and we have largely been convening communities around climate action to answer the question, what can I do regionally? What can we do as communities? And we want to be leveraging climate solutions for a healthy planet. Ultimately, helping our community take big and immediate steps to reduce carbon emissions is what we're aiming for, so that we can create healthy alternatives for us and others. We believe in partnering and supporting locally governed agencies that support climate change investment, innovation, and transformation, which is why we love participating in things like this with the Daily Journal. And our key program for today is our Healthy Plate, Healthy Planet. The main goals for Healthy Plate, Healthy Planet is that food choice can play a leading role in shaping a livable climate with a flourishing environment. We make choices every day with what we eat and how we source what we eat. And Actera is really leaning into this, particularly in communities that have less access. We want everyone to feel equitable decision-making. We want to be providing resources for those that may not have them. And our Healthy Plate, Healthy Planet program helps these people make daily decisions to scale up to large impacts. Once one family does it and another family does it and then a community does it, we're seeing huge growth around plant-based diets in particular. We're seeing large impacts around food waste, and we're also seeing the direct correlation to health impacts because of the food we eat, not only for our human health, but our environmental health. One of the goals that Actera has is adopting a plant-forward diet and reducing the waste that can be created through our economy of food sourcing. This is all a significant reduction in greenhouse gas emissions, and that's what we're hoping to see for our people and our planet, including the improvement of our food and always thinking towards lowering costs for all of our communities involved. Another key program for Actera is beneficial electrification. One of the things that we prioritize is the acceleration of adoption of all electric appliances, buildings, and vehicles that operate on clean energy instead of fossil fuels. We know in communities like East Palo Alto that are so close in proximity to major freeways, they really suffer higher cases of asthma. We know there's a direct correlation to emissions, and we know that by focusing on clean energy usage, we can start to reduce the amount of environmental impacts that communities are suffering. Beneficial electrification supports not only the general public, but small businesses, industries, municipalities, authorities, the state itself, all utilities, and other nonprofits like Actera towards meeting the climate goals of the entire region. So we're doing this to be part of something bigger than just Actera as a small local nonprofit. Electrification of energy end uses in homes and buildings is a major strategy for us in combating climate change. So our end goal is that homes will be using clean energy and electricity rather than pulling fossil fuels from the earth, which we know also creates adverse health impacts for our local communities. Sticking to time, I just want to leave this so you can check out our website, learn more about our programming, learn more about how we're working with marginalized communities, under-resourced communities, and frontline communities to combat climate change, even so much as looking at adverse weather effects because of climate change and these high heat days, these wildfire days like we're currently experiencing. So please go to our website to learn more. Again, this has been such a pleasure. Thank you so much for this opportunity. You can see our Actera family in that photo attached, and we'd love for you to be part of our family. So check us out and join when you can. Thank you so much.
Lauren, that was awesome. Thank you so much for that great presentation. I'm going to admit for just a second that I snuck over to your website while you were talking. I want to congratulate you on 50 great years. Actera is a wonderful partner in the community, and we're all trying to do our part to reduce our greenhouse gas emissions. Going to all electric buildings is one of the key parts to that, and it means better health for all of us.
Absolutely.
We see huge asthma rates, especially in the Bay Area, especially in the East Bay, and a lot of that has to do with the greenhouse gas emissions that we see. I just want to congratulate you again on the 50 years and let you know San Mateo is very proud to partner with you in order to make these huge impacts in our community. It really matters, and it has a much larger health impact than most people realize.
Absolutely. Thank you so much for calling light to that. And thank you again for the opportunity to speak today.
Lauren, it was great to be with you. Thank you again to Actera. Congratulations on the 50 years. Wonderful. Thank you for joining us. I am going to now take a look at my schedule, and I see that we have next Anthem Blue Cross
Yes.
Medicare for San Mateo County. And I'm going to look and see that it is Laura. Laura, welcome. Thanks for joining us.
Hello. Hello, everyone. I'm Laura Nanata. I'm with Anthem Blue Cross Medicare. And thank you so much, presenters. You did an amazing job today. This is very exciting to be a part of this virtual fair. For some of you know that Anthem Blue Cross is actually new to San Mateo County. And let me tell you, I've really enjoyed how welcomed I've felt here in the community. The programs you have for our communities, for our seniors, is just outstanding. And I feel very blessed to be a part of it. I think I'm sharing my screen. Is that happening? Yes.
Yes, you are. Sorry, I was muted
Excellent.
for a second. We see your screen
Excellent.
and it looks great.
Okay, super. I know that the theme of our health fair is staying healthy and active and finding ways to do that. So I thought I'd share about activities I've done that are COVID approved. And one of them is golfing. And you guys have a great golf course here in San Mateo that I really enjoy. My sport, my game has gotten a lot better since that's all I can do besides spiking, and also going to the beach and, you know, eating tortilla chips. So been enjoying those very much. Let's see how I get to the next one. Oh, yes. Upcoming events. So we are here today for the virtual fair, and we'll be giving out for no obligation, of course. If you want to give away, I know that a lot of our health fairs that we've done in the past, participants get giveaways, and we'd like to do that. So I know that we can have some addresses mailed to the journal, and we can mail those out to you. We'd like that. And if you'd like to learn more about Medicare, if you're turning 65, you have parents, you want to learn more about it, Anthem Blue Cross actually has information on Facebook, and you can participate in a webinar like this. Or you can also call Yami Lai, who I'll introduce in a minute. Other events that'll be taking place in October 15th through December 7th is the annual enrollment period for those who want to learn more about Medicare or need to change their plan. We'll be doing live presentations in October at the Hampton Inn in South San Francisco. We'll be doing one at 10 o'clock and then at 1 o'clock, and there'll be socially distanced, masks, everything, sanitizer. One will be in English and one will be in Chinese. We'll be doing another one at the San Mateo Marriott. And then for those who prefer to be outside, we'll be at Par 3 in San Mateo at the outside patio at 10:30. So without further ado, I'd like to introduce Miss Yami Lai. She has been proudly serving the community and lives in Pacifica for 10 years. It's been a while. She's, I'm really proud to be working with her.
Laura, that's great. That's great. And welcome, Yami. And thank you very much.
All right.
Hello, good morning. Can you guys
Good morning.
hear me?
We can hear you, and we're looking at the slide right now that has your phone number on there.
Yes. Good morning, Mayor. Good morning, everybody. My
Morning,
name is
Yemi.
Yemi. I'm the local service representative. I'm serving a Medicare community for over 10 years. Also, you can see my slide. I speak Mandarin and Cantonese for the second language. Okay, so and also I'm providing all the informations about the Medicare, how to apply, what is the procedure, and what is the A, B, and C, and D. And also Anthem is providing different options for the plan. For example, Medicare supplement is good for the freedom of choice, more flexibility. And also we do provide Medicare Advantage plan, more affordable plan. And the last, I really like it for the prescriptions because if you have questions about the medications cost, I can help you to check also.
All right.
So if you have any questions, so feel free to call me anytime, okay? And also what makes Anthem Medicare difference, we do offer extra benefit for over-counter every year, personal emergency response system, and also we do offer the food for the COVID-19, helping a senior for difficulty to get to grocery and get the food, and also for discharge hospital also. And the last two pictures you can see on the right hand is a hearing aid. We do offer 3,000 yearly every year, 3,000 hearing aid and the transportation. And also we do offer the Dream free membership also. Thank you so much, everybody. So thank you for joining. So thank you for Daily Journal to invite Anthem to being with you guys, share the informations. Again, if you guys have any question about Medicare, Medicare supplement, Medicare Advantage, and some prescription plans, so welcome to call me anytime. I'm here for you. All the, anytime, call me. And at the last, make sure to call me for giveaway.
Yes.
So thank you for joining, okay? My number again, 415-231-4602. I love San Mateo. I'm living in San Mateo. Thank you.
Thank you, Yami. That's fantastic, and we're going to keep that phone number up on the screen for a minute. And Yami's email is yami.lai@anthem.com. That's YAMMIE.LAI@anthem.com. And Laura's email is also there, laura.nanada@anthem.com. Thank you so much to Anthem Medicare for joining us this morning and letting us know how to get in touch with you. Anybody who's reaching the age of 65 is starting to think about their next health insurance option. I think some of us want to get there very quickly because we know the great coverage and savings that being on Medicare can provide. So thank you, Yami, and thank you, Laura, so much for that beautiful presentation.
Thank you. Have a great day.
Have a great day. Moving
Thank you.
right along, thank you. Moving right along, we have California Relay Service.
Hi, yeah, I'm from California Relay. My name is Janelle.
Janelle, welcome.
Yeah.
Thank you for
Hi.
joining us. Welcome, and the stage is yours.
Great. All right, so can you see my PowerPoint?
I muted myself for just a second. Yes, we see it. We see it. California Relay Service looks great.
Great, okay. So hi, everybody. My name is Janelle. I am a outreach coordinator for California Relay Service. And I'll try and keep this short and simple, just since we're a little bit behind on time. A little bit about relay services. They're specifically for individuals who are deaf, hard of hearing, deafblind, or have difficulty speaking. Relay services are telecommunication services that allow basically individuals who have difficulty hearing or speaking over the phone. The history with that is that the ADA just celebrated their anniversary in July, and the FCC mandated these relay services for each state since 1993. A lot of these relay services use specialized equipment, which I will talk about a little bit later, and these services are available for users and receivers 24/7. And since we are a state program, California Relay Service, under the Deaf and Disabled Telecommunications Program, our services and the equipment are free. So the different types of telecommunications relay services that we do have available provided for California residents are TTY, which is basically what my generation would call nowadays modern or the original texting, so to speak. So individuals who would use TTY would have like a typewriter that they would use to communicate. Then there's something called voice carryover, and voice carryover is for individuals who prefer to use their own voice but have difficulty hearing. Hearing carryover is basically about the same thing as voice carryover, but the opposite. So for individual who can still use their own hearing but have difficulty speaking. Speech to speech is for individuals who have difficulty speaking as well. This one is specifically for individuals who may have experienced a stroke or Parkinson's, who have difficulty communicating over the phone. Deafblind services are for individuals who have a combination of hearing and speaking difficulties. So it's really cool because deafblind services, they are able to use a device that they can communicate with a Braille device and still speak to a standard telephone user. And then one of the last relay services is Spanish. So all of these call types are actually available in Spanish as well. So I think that's really great. And then we also have a caption telephone. So that's not a traditional relay service, but caption telephone is similar to voice carryover, where the individual would use their own voice to communicate, but they do have difficulty speaking. So captions of what the other party is saying appears on the screen as they're speaking over the phone. A little bit short version of how basically this works. So a relay user who uses a TTY or has voice carryover services would call us, and they would connect to a communication assistant. And of course, depending on how or what services they use, the communication assistant would then connect to the standard telephone user. So for instance, in this example, let's just say the relay user is calling his sister. They would have a communication assistant in between so that they can still communicate while he's using relay services. And then they would just continue that method in between. We are a close partnership with California Telephone Access Program. Unfortunately, they're not here today, but here's their information. So the way that I look at it is we essentially provide the relay services, so the communication assistant, and they provide the free devices. So we're both state programs and both available throughout the state of California for all California residents. And I know that this was a lot of information. Please, here's my contact information. If anybody has any questions, please don't hesitate to contact me. I know that there's a lot of options available, and I touched on a lot of information. But again, my name is Janelle. I'm an outreach coordinator for California Relay Service. And yeah, please let me know of any questions.
Huge thanks to California Relay Service and to you, Janelle. Thank you for a great presentation with lots of information. Your email is right there along with the website. Just fantastic services for anyone who needs them, anyone whose life is affected by someone with different abilities. California Relay Service is there for all of you. Thank you, Janelle. Our next presentation is coming to us from the Center for Independence of Individuals with Disabilities Support Services.
Green is that?
Hi there, waiting for a presentation.
It's coming.
I need to be allowed to share my screen. This is Vince from CID. I am not allowed. There we go. Oop.
Well, I guess I can start. So first and foremost, I would like to thank the Daily Journal for having us here today and for all the presenters who are here today as well. Thank you so much.
Ah, yes. Okay, just 1 second. Go technology.
I want to thank Lisa and Vincent for being with us all morning, and we look forward to your great presentation about
Thank
the
you.
Center for Independence of Individuals with Disabilities. Thank you
for
both
the
for being with us.
Yeah, thank you for the introduction. Hi, everybody. My name is Lisa, and I'm here with my two colleagues, Vincent and Paul, and we are from the Center for Independence of Individuals with Disabilities serving San Mateo County. We are a nonprofit, and we provide a variety of support services for people with disabilities. This is Ed Roberts, and if you don't know who Ed Roberts is, do yourself a favor and look him up. He is a pioneering leader of the disability rights movement. He went to Cal and he attended class by telephone before he decided to fight back for accessibility. So he's the reason why we are here today, still fighting for disability rights. His name is Ed Roberts.
And he also grew up in Burlingame.
Yeah, he
Right.
went to CSM and he transferred over to Cal.
And a visual description of the pictures. On the top left, there's a newspaper article, iron lung patient, a quadriplegic to run the rehabilitation department. In the bottom left is a picture of Ed Roberts with his family with his iron lung in the background. He had polio. And the center picture states disability is strength. Celebrating Ed Roberts Day. Disability is not just a part of life. Anyone can join our group at any point in life. In this way, the disability rights movement does not discriminate. On the picture on the right is a picture of Ed Roberts in his power chair with an African-American person who has a guide dog.
Thank you, Vincent. Our support services include peer counseling, otherwise known as peer support. And we'll talk a little bit more about, excuse me, peer support, the housing accessibility modification program, the assistive technology program during this presentation. Independent living skills, we help with everyday life skills. One of our core services is information and referral, and this is where our housing workshop falls under. We provide information on how to get started in applying for housing. We don't actually place people, but we get you started through that process. Transition services for those who are transitioning from a nursing facility to independent living. We can help you apply for benefits and other resources you may need. Independent living planning. Systems change advocacy. We do have an advocate that mandates at the local and the state level. The youth program, is a very good program for leadership skills through volunteer work, advocacy, and mentoring. Financial benefits counseling for those who currently work or are interested or planning to go back to work. We can we can counsel on how it's going to affect your benefits. And then the latest and the greatest program is our PG&E PSPS power shutoff with a public safety shutoff. We do provide support services such as alternative housing and backup batteries. And then we also have the CalFresh program, which is the otherwise known as the food stamp program. The housing accessibility modification program. So this is my program. It's a CID program which targets people with disabilities. It's free of cost to income qualified consumers. When I say free, and people are like, whoa, wow, really? This is free? And I'm like, no, it's free. When I say free, it's absolutely free. You do not pay anything out of pocket, not one penny. And in order to qualify, one must be a resident of San Mateo County, be a person with a disability or have a real need for the modification. I'm not gonna, grill you on what's going on with your health situation, or it's just as long as you have a real need, we don't screen, and it's income eligible. The income limits for San Mateo County are really high. Just to give you an idea, so for a household of one, the income limit is 90,000. So as long as you fall below 90,000, then you qualify for the program. These modifications promote independence, increase safety, and improve accessibility. And I always like to say this because it's so important that these modifications make a profound impact on someone's life. It does wonders to one's self-esteem just to be able to have that ramp and get out of the house. This program assists with the installation of home accessibility modifications, including but not limited to grab bars, handrails, wheelchair ramps, stair lifts, porch lifts, ADA commodes, handheld showers, a shower chair or bench, a toilet safety fan, bed rails, and walker steps, and the list goes on. And this is just a before and after work picture. So this is a picture of a porch lift installation, and this gentleman resides in San Bruno, and on the left you see the before porch lift installation. And then on the right, you see the after work. So you see the work done. And you can see how we laid down a pretty substantial platform before we installed the porch lift there. So this is just an example of one of the projects that we do through our Housing Accessibility Modification Program, which is a great program. It is absolutely free as long as you qualify and you live in San Mateo County. It's a great program. At this time, I would like to introduce my colleague, Vincent Lopez.
Hi, I'm Vincent Lopez. I'm the Assistive Technologies Manager for Center for Independence. And go quick little overview of our program. For assistive technology, we offer information and referral. If we are not the expert at the subject matter, we will refer you to someone who is. With disabilities, it's a huge, wide range of things. So again, if we don't know it and we can't find the answer, we will refer you to someone who has the answer. We do outreach. We attend and host local events, including transition fair that they hold yearly in San Mateo County for students that are transitioning from high school into work life and college. Senior fairs, again, the San Mateo Daily Journal fairs, we love to attend. We were doing a movie series at San Mateo Library previously, but now we have COVID. And we meet with local vendors for resources. Training, I like to work with clientele on the use of their AT items and specialize it on the assisted technology side of it. And also we are focus driven. So we're more task driven than a lot of other ways to kind of approach a situation. So we try and go by which task you need done, and then we find a way to make it happen with assistive technology. And we also offer advocacy. If a consumer is having issues getting assistive technology, we'll help advocate for them on getting it. We also sit in for individual education plans for students to help advocate for assistive technology for students also. Then our main program with assistive technology is our reuse program, where people donate durable medical equipment in like new condition. We turn around, clean it up, and give it back out to the community or sell it at a discounted rate. Because usually a lot of items need repair, so we use that money to kind of recirculate to repair items. We do wheelchairs, scooters, power chairs, walkers, canes, rollators, patient lifts, commodes, bedpans, shower chairs. We're even taking incontinence supplies because we found that there's a need for them also. And we also, you could always feel free to contact me if you have any durable medical equipment, or if you know somebody in need, we can go through and try and get that out to them. And we also offer a peer support group that meets on Thursdays through Zoom for any individual, disability or not, to kind of get together and kind of go over, how they're dealing with COVID, having different projects to do and whatnot. And then you can reach Alex M at cidsanmateo.org. The picture is just, it says peer support, and it's got 3 outlines of individuals. And now I'm going to turn you over to Paul Cruz, who is my colleague that's working with the PG&E Power Safety Shutoff Program.
Hello, everyone. Thank you for having us. My name is Paul Cruz. I am the project coordinator for our PG&E Public Safety Power Shutoff program. So CID is partnering with PG&E to provide resources for individuals who have disabilities and also for the ones who rely on medical equipment that will be severely impacted in an event of power shutoff. All of our resources are available on our website. You can get more information to see if you qualify by visiting www.cidsanmateo.org. Currently, we're partnered with community-based organizations along the coast and throughout the peninsula to provide resources for all of our residents here in San Mateo County. Our next slide is our CalFresh program. CID has a CalFresh program which provides families in San Mateo County with electronic benefits transfer cards, EBT cards. Those households can then use those benefits to purchase fruits, vegetables, bread, and other dairy products at participating stores, local farmers markets, and other markets. Lastly, as Lisa and Vince mentioned, we have a virtual housing workshop, which is facilitated by one of our CID staff. Again, the purpose of it is to provide resources and assist individuals with disabilities in San Mateo County to get started on the process. Our team has experience with obtaining below market rates and other housing resources. Again, you can access all of that information and the contact information of the team at www.cidsanmateo.org. And that would be it. Thank you very much for the opportunity for CID to come at the virtual resource fair. And if you have any questions, again, our website is up, www.cidsanmateo.org. Thank you very much.
And I just got one more thing to add. This is Vince from CID. Since we are in a heat wave, I recommend either getting something like this or like a bandana that kind of keeps you cool, especially for this time right now, or purchase some misters or get a bandana, wrap it in, dip it in ice water. That'll help kind of keep you cool because we don't have air conditioning in San Mateo because we never reach 100-degree weather. And of course, now we're reaching 100-degree weather. So just trying to think of little assistive technology items that might be able to help and things you wouldn't think of, like using household items. You could also get ice water and put it in a tub in front of a fan, and then you got your homemade swamp cooler too. Thank you so much for allowing us to be in this presentation. And
thank you, Vincent. Thank you to CID San Mateo, everybody, cidsanmateo.org. We are so lucky. We are so lucky as a community to have you here, and all the people who are helped by you. Independent living is so important. Connected living is also important. As we saw today, making sure that we don't lose touch, that we don't get isolated, especially during these times of quarantine, also very important and essential. I'm going to take this moment. We scheduled me as the mayor to speak next. I'm going to just take a minute here. We're going to try to get to as many questions of yours as we can. So please ask your questions in the Q&A, ask them in the chat, and we'll get to as many as possible. But just for a minute about me, I'm the mayor of San Mateo. I have a background in public health. I got a master's degree in public health. I worked in public health for so long. And for me, when I joined the city council, it was to give back. It was to work with the community. It was to help. And I never thought, you never know what you're signing up for. And I never thought that we would be faced with a year like 2020. My wife and I are raising our 3 daughters here in San Mateo. And this year started out exhausting. We were so busy. We saw COVID hit. We saw the economic effects of COVID. We've seen forest fires. We've seen earthquakes. We've seen just about everything you can imagine. And between the pandemic and the recession and the forest fires. And I will remind you that we've had over 2 million acres of forest fires. This is now the worst year of forest fires on record in the state of California, and we're not done yet. With all of those things, it's been exhausting. Many of you know your city council members, and like me, they're probably exhausted too. We're doing everything we can to respond in real time based on the best information available. And I've seen it in my own family, what this can mean, and what the isolation of quarantine can mean. And I'm here to tell you that it is absolutely essential that we take care of each other. Yes, we have to follow the instructions that are given to us from the experts. You've got to wear a mask. You've got to stay socially distanced. You've got to wash your hands. That's your responsibility to the community, because we have to take care of each other if we're going to keep the numbers down. And the only way to open back up is to keep the COVID numbers down. That's how we're going to save our economy. That's how we're going to save each other and keep our jobs and take care of our mental health. I want to reiterate something that was said earlier about how important mental health is. If you're not taking care of yourself by giving yourself enough sleep, by exercising, by eating right, by reducing your alcohol consumption, then you're not taking care of yourself. And if you're not taking care of yourself, then you're not going to be effective at taking care of others. Be in supportive relationships with as many people as possible. Take care of the people in your household. Do what our first speaker told us about, mindfulness and breathing. And of course, the last thing that he mentioned is probably one of the most important, and it's what my family does every single day. We have a sticker chart reminding us to get all of these things done, to exercise, to eat right, to sleep right. And the last one that we have to do every day by the time we get to that dinner table, gratitude. You've got to be thankful. Even in these times with the things that we face, being thankful is incredibly important. Be thankful for the essential workers who are out there working for you. Be thankful for the firefighters who are fighting these forest fires. Be thankful to the essential workers in the hospital who are working with Bill Graham. Be thankful for your family. Be thankful for your health. If every night before you go to bed, you remind yourself to be thankful, we will all have better mental health, and that's what we need right now. With that in mind, I want to turn it over to our next presenter. We have Chris here from HIP Housing, and to talk to us about the home sharing program. Chris, are you there? Hi, Chris, welcome. Thanks for joining us this morning.
Thank you, Mayor Goethals. My coworker, Alexis Nunez Aguilar, will actually be taking the reins first, and he's also on.
Fantastic. Alex, welcome.
Hello there, thank you. So do I just share my screen?
Yes, please.
Sounds good.
And a reminder to everyone at home, we will get to as many questions as possible at the end of the presentations. We're running a little bit late, but we'll try to get to as many questions. You can put them in the chat, or you can put them in the Q&A section, and we will get there. Alex, the floor is yours. Welcome. We can see your presentation, and it looks great.
Okay, sounds good. Thank you so much. So hello, everyone. My name is Alexis Nunez, and I'm the marketing intern for HIP Housing this summer. Today, I'm presenting with our community outreach specialist, Chris Thurkin, and we'll be sharing some information on what HIP Housing is. And so you may be wondering, what is HIP Housing? And to answer that question, HIP stands for the Human Investment Project, and we are a nonprofit organization based in San Mateo County that specialized in affordable and creative housing solutions in the county since 1972. And as of now, our home sharing program consists of 650 people, along with our self-sufficiency program, in which 100 people are enrolled. Each year, HIP Housing helps 1,400 people find housing or keep their homes through our home sharing and self-sufficiency programs, as well as through the 28 properties we own and manage. And overall, we want to let you know that we are here for you. Our services are free of charge, and our team is composed of very passionate members of the community. In the time that I've been part of HIP Housing's team, I've been able to listen in on calls and see how determined our team is to make sure you find the perfect home. And as someone who has lived in the county his whole life, I have seen many changes across our communities. And rent prices have reached the highest they've ever been. But like I stated, we're here to make sure you get the right home for the right price. And HIP Housing enables people with special needs, either from income or circumstance, to live independent, self-sufficient lives in decent, safe, low-cost homes. And can we please switch the screen to Chris? Hello, sorry. Can we switch the screen to Chris, please?
Alexis, I think if you stop sharing your screen, then I can share mine after that.
There you go. Sorry about that.
No worries. Thank you, Alexis. All right, so I'm going to share my screen as well. Okay. Thanks for your patience, everyone. Really glad you're here. Alrighty. Okay. Can everybody see that all right? Okay. Great. Again, my name is Chris Durkin. I'm the Community Outreach Specialist for HIP Housing. Oh, Mayor Goldfuss, were you going to say something?
Just that it looks great. Sorry, I was muted. I was trying to tell you that that we can see your screen.
Thank you so much.
Thanks, Chris.
No problem. All right. So the way it works is that our home sharing program matches homeowners or renters who have an extra space or a second unit that they want to rent out to someone who is looking for a place to rent or has a housing voucher to support that rent. And we interview all clients. And the one requirement is that you live, work, or go to school in San Mateo County. Our program is specifically for families of 1 to 2. That includes, someone who's single or a couple or a parent and child, because the majority of our home providers or landlords who use our program tend to look for, 1 or 2 housemates. But again, the way that works is that we interview all clients, asking them what reason they have for looking for housing or for a housemate, what their preferences are in a housemate. And we do ask for income verification from people who are seeking housing. And with that information, we give you specialized referrals for potential housemates, giving you their name and number, profile information about them, and we can provide their references as well. And so if you decide that you want to match with someone using our program, we'll then facilitate a meeting to sign a living together agreement that includes the rental terms as well as any living arrangements that you have come up with, whether it be like a household cleaning schedule or the parking situation or whatever it may be, so that you have a written record of your agreement and can then refer to that in the event that anything changes, such as the utilities go up or maybe your housemates changes their work schedule. And so you can refer to that document and make any changes as needed. If for some reason you can't come to an agreement about a particular issue, our home sharing coordinators are there to support you over the duration of your home sharing match. So we check in with you regularly, and then you can call us if you need help resolving an issue. And just then go to the next slide here. Okay. And so some of the benefits of using our program include that you can share housing costs. And that's especially important right now, right? During this pandemic, while many of our clients and many people in the community are out of work or have reduced hours, home sharing can bring in some extra income. And in addition, it can also provide companionship during this kind of lonely time, right? While we are cooped up in our homes, to keep ourselves safe from the pandemic. And so the way that you can apply to our program is really simple. Simply visit hiphousing.org and navigate to the home sharing page. There's a bright orange button called Inquiry Form. And it simply asks for your name, your number, email, how you heard about us, which you can say this fair today, and what you are looking for. Are you providing housing? Are you looking for housing? And then we'll contact you to arrange a virtual appointment, no contact, right? A virtual appointment via Google Meets. And if for some reason, maybe you aren't familiar with Google Meets or Zoom or any of those other platforms, our home sharing coordinators can walk you through it over the phone to make it really easy to attend that appointment and learn more about our program. So you can either, again, visit hiphousing.org or call us at 650-348-6660 to learn more about how you can find a housemate or find housing using the home sharing program, which is a free program for residents of San Mateo County.
Chris, we're getting a question right now about are there available units and how long are the wait lists?
Good question. So our particular properties do have a wait list that is currently closed. However, we do have an interest list, and the interest list, the folks on the interest list will be notified when the wait list reopens. And if, you know, they comb through the wait list and there aren't any eligible applicants, or, you know, people pass up a particular unit because they found other housing elsewhere. So there's still a possibility of, you know, being able to apply for a unit managed by HIP Housing or owned by one of our properties. And you can simply visit, again, hiphousing.org, visit the properties page, and there's another bright orange button that says interest list that you can click to apply to the interest list.
That's fantastic. Thank you so much for another excellent presentation. I find that I probably recommend equally the people who have an extra room in their house. I tell them about HIP housing as much as I tell people who are looking for an extra room and someplace to live. So it's a great program to match those two together.
Thank you so much, Mayor Goldfels. Really appreciate it.
Thank you, Chris. And the information's right there, hiphousing.org. Moving right along, we have another presentation. And at this point, we are bringing in Rika. Is that from Meraki Real Estate?
Hi, everybody. I'm Rika Ruiz, the founder of Meraki Real Estate in Foster City, servicing the greater San Mateo County area and beyond. I was asked to share with you today as a business owner who is now working from home, and a mother of a preteen who is distance learning from home, and a wife is dealing with the pandemic. And I have to be transparent with you guys. There are some days that are better than others, and some days where it is incredibly hard. And I just want to share with you 5 things that my family and I have done, and we don't do it perfectly, yet 5 things we've initiated in our family to create some sense of peace and sanity. And the first thing is time blocking, and what that looks like and what that means is letting the family know that at a certain time, and for us it's 9 a.m. to 4 p.m. is work and school time, and somewhere between 4 and 4:30 is family time. And family time for us, it means lots of board games. We've played our fair share of Yahtzee, Monopoly, Uno, and a very good friend of mine introduced us to Dutch Blitz. So fun, highly recommend it. Yet when we time block and everyone has an expectation and knows when work is and school is stopped and when family time starts, it just creates so much peace in the home. The second thing is physical activity. So my son was so active before shelter in place, and I was astonished at how difficult it was to keep him engaged in activity. I thought that was the one thing that would not be that hard to do, yet it was. And thankfully my husband and I, for the most part, are pretty active. And as a family, we play basketball together, we go on walks, we go for runs, bike rides, and recently my husband and I took up tennis again, and I had forgotten how much I love tennis. So definitely physical activity, getting some fresh air, and I know recently it hasn't been fresh air yet, just going out and having some physical activity. The third thing I would suggest is exploring new hobbies, maybe something you've never tried before and always wanted to or didn't have time for, or something that you loved and somehow just stopped having time to do. And for us, we were learning new languages. I'm learning Tagalog, and my husband and son are learning Spanish. And one of the things that we did too is I'd never been to Mount Diablo. And so we went for a hike at Mount Diablo, and it was amazing. Just thinking that we were so limited on the things that we can do, yet in the midst of this, we were able to do something I'd never done before. So that was really fun. The fourth thing I would suggest is to stay connected with your family and your friends and your loved ones. We all were created to be in relationship, and now more than ever, I really believe we need community. So whatever that looks like, and for me, it's been so fun to reconnect with old high school and college friends and just leveraging that technology to see them on video, and even family across the country. What an aha moment for me to realize that this technology has been here all along and I'd never used it. And now I'm using it to reconnect with old friends and family. So stay connected. The fifth thing I would recommend is to volunteer. And that looks different for many people. I was completely transparent with you guys that there are times when it's hard for me and I break down and cry. And I think it's okay to do that. We are experiencing something this country hopefully will never have to experience again. And it's been lonely, and we've grieved different losses. So when I go volunteer, it takes the focus off of me. I've been volunteering over in Redwood City, putting food together for food distribution to the under-resourced and the most vulnerable families in the Fair Oaks community. Many of them cannot afford groceries, and that just blesses me to be able to bless them in that way, and cultivates a heart of gratitude when I start to feel down for myself. And maybe I know you can't, some people aren't ready to go out and volunteer in that way. There's other ways to do that. For me as a business owner, I've been intentional about calling my clients and my colleagues just to check in on them and see how they're doing, especially those who are elderly and who are single. And it's such a gift for them to be able to talk to me and know that someone's out there that cares for them, and you could be that to somebody as well. Also, our business, we have offered monthly webinars, hopefully providing information that is beneficial to you. And if there's anything that you guys want to hear about, please let me know. I'm open to it, and it doesn't have to be real estate related. We've had trust and estate planning attorneys share. We've had financial planners share. Last month, we had a licensed family and marriage therapist share about how to deal and cope and care for ourselves amidst this pandemic. So there's a lot of opportunity to help other people, and it doesn't necessarily have to be face-to-face, but I think we all know once we help other people, the focus is off us and we feel blessed to be able to give to others. So those are my 5 tips for all of you. Again, real quickly, is to time block is 1, 2 is physical activity, and 3 is exploring something new, and 4 is staying connected, and 5, volunteering or doing something for someone else. So I wish you all continued great health and safety. And remember, I know there are times when we feel alone, yet remember we're alone together. And I look forward to the day that I can see you all face to face soon. God bless you.
Let's go to the next presenter, Richard So. Richard, welcome. Thank you for joining us this morning.
Yeah, thank you so much for this opportunity. Thanks to the Daily Journal and all of these amazing panelists, and thanks to all the community members joining us today. My name is Richard So. I'm the executive director of a community organization called SF Hep B Free, and we work on hepatitis B and preventing liver cancer in the community. First, try to be real quick here. I think that real estate person is going to talk about mental health, but as everyone has been saying, important and kind of crazy time. And so we really want everyone listening, especially potentially those who are a little older that there is still a lot to do, whether that be spending time with your family. I know it's a lot of technology to get the grips on, but it's easy as a click to get to some of your nephews and nieces and such. Taking up any hobbies, whether that be something like woodworking or exercise safely or crocheting, all of those things keep your mind sharp, keep you active doing those things. And you'll find if you find a new passion or this is an opportunity to do so, you know, we often say we don't have time. There's so much on our plate. And I wish I had learned this. I wish I had done that skills. With things like the internet and YouTube, you can learn all those things. So I hope all of you out there are staying healthy in here and in your body. So with that, I'm going to talk a little bit about my organization and why it's important that you know about hepatitis B and the liver cancer it causes. So I'm going to share my screen here. All right, how's that?
That looks great.
Great. So why hepatitis B matters to you. So many of you may not know what hepatitis B nor have ever heard of it. You may have heard of hepatitis C. This is a similar disease. About 1 in 3 county residents, San Mateo County residents, are Asian Pacific Islander. And the reason why that's important is that 1 in 12 Asian Americans, adults, have chronic hepatitis B. And 2/3 of those people who have it don't know it. Unfortunately, very sadly, 1 in 4 of those who are chronically infected will develop fatal liver cancer or liver disease. And so if you think about that, 1 in 12, and then the vast majority of not knowing it will get this liver cancer or liver disease, you might say, how is it possible that I haven't heard of this? How is it possible that people don't feel sick? That is the problem with both hepatitis B and hepatitis C, is often it is a virus you contract at birth through the birthing process, and it sits in your body, in your liver, slowly doing damage, and you don't actually feel sick until it's too late. And by that time, usually people have pain from the liver cancer that it causes, and once you go into the doctor, unfortunately, liver cancer is very deadly. But there is so much we can change about this. So hepatitis B is known as a silent killer because it doesn't have these symptoms and it's too late. But there's an effective vaccine and an affordable, simple treatment so that no one should be dying from this disease. The vaccine, you might know this if you have children who have children, you're required to get it for school now. And so most of those who are affected by this are those immigrant families, even those who have been here for 20, 30 years, who are now parents, grandparents from Asian countries who are the prime, unfortunately, victims of this disease because they don't know it, despite the fact that it is such a beatable disease. It's really all you need is a simple screening that you ask from your doctor. And if you catch it when it's still a virus, treatment, which is just management with your doctor, makes the vast majority of people never develop any sort of serious liver disease. Just a quick background on who we are. We were founded long ago in San Francisco in 2007 to address this lack of information on this topic, and spread to San Mateo in 2017 because of so many of the Asian Pacific Islander residents in the county. We work significantly, we're a small group with local health, so San Mateo County Healthcare, places like Kaiser, places like Dignity, advocacy groups. You can see some of the groups that we've worked with here, the Peninsula Healthcare District, all to promote this awareness. This is just a quick demographic picture, snapshot of San Mateo County. If you didn't know, if you look at that chart in the middle, you'll see that 56% of Daly City is Asian American, 45 of Foster City, 43 of Millbrae. So this is a lot of, and it is a disease that's passed through bodily fluids, primarily blood and sex. So interracial marriages and relationships have that risk of passing this disease. So it is not just strictly Asian Americans or immigrants, as well as if you're going to plan to travel to those countries, you're at risk if you have to interact with those healthcare systems. So this is really quick. I'll probably jump kind of through this. What you need to know is the most dangerous version, the chronic version. That's the version of this virus you get if you're little. And so that's most often contracted when your mother or father have the disease and you live in that same household. You can get the acute version, which is if you're when you're an adult and you're in a relationship and you may have sex, then that transmission is possible that way. But that acute version is not lifelong and is usually cleared by the body by itself. As you can see here, it is transmitted by blood and sexual liquids, but not saliva, sweat, urine, or tears. There's a common misconception that you can't share food, that you can't share bathrooms with someone who has Hep B. That is all not true, and that's one of the things we fight as well. Other things here, IV drug use, although that is a less big issue for hepatitis B. So now that I may have scared you on this disease, here's a map on who should be tested. If you look at what you really need to focus here is on the red. Those are countries where the rate of hepatitis B is around 8% or higher. And the CDC recommends anybody who is born in these countries or who have parents born in these red and yellow zones be tested. So as you can see, that is a lot of people. Most immigrants from many of the minority countries fall into that category. So whether you may have, I'm sure you may have Asian American neighbors. This could be your neighbor, who is raising his children and has no idea about this disease and could be one of these victims, these ticking time bombs. So what we do as a small group, we go to free community educations, things like the health fair that we normally attend in person to teach people about this disease. We do free in-community screening. We bring the phlebotomist right there. That way you don't need to make a appointment with your doctor. We have in-language speakers from everything from Tagalog to Cantonese to Mandarin, all there so that people are comfortable. We also do physician education so that community doctors like your doctor that you might see remembers this and is able to tell their patients that. And finally, we have a website where we provide a vast array of links to care and resources. Right here, if you can see, are just a couple photos of our work. The top left one is just us tabling at I think a county health fair. The top right is a screening and education session at a Lions gathering in Daly City. Bottom left is a education to some Kaiser docs at, I believe, Kaiser Redwood City. And the bottom right is us tabling at the San Mateo County Fair, actually, with a San Mateo County supervisor who joined us that day. So we're really pride ourselves on being out there and being able to get to the community. Finally, our call to action, how you can help, just two really simple things. Get tested if you think you need to. Call your doctor and say, hey, this one Asian guy told me about this disease that I should be worried about. Do I need to worry about that? We have literally had people call us back and say, I called my doctor, got tested, and turns out I have it, so thank you. So this little thing, to your neighbor, your friends in Rotary or any of those type of organizations, this is a disease they're not going to feel sick about and they could still have. Fight the stigma, fight the silence, talk about it, and that's all we ask. If you need, if you want to contact more or learn more, you can visit us at sfhepbfree.com, or you can reach me through the email or my phone number right there on the screen. Otherwise I know I gave you a lot of attention, a lot of information for a short amount of time, but I wanted to keep this rolling. So thank you so much. And please let me know if you have any questions.
Richard, that was fantastic. Great presentation. Thank you so much for all of that. For those of you at home who want to ask your doctor, get tested, find out more information at the website. Richard, thanks. Have a great day.
Thank you so much. Yep.
We've got two more quick presentations, but before we get to the next presentation, I want to ask all of the attendees, if this is helpful, if you find this valuable, if you just want to say thank you to the Daily Journal, raise your hand in the chat. Let us know that you're still here, and just show us that you appreciate what we're putting on today. I know the Daily Journal will appreciate it. Let's see all those hands get raised as I turn it over to our next presenter, Claire from Stanford. Claire, welcome. I see your presentation on the screen already.
Yeah.
And I see those hands getting raised. We still have over 100 attendees, and everybody's raising their hand. I think they appreciate what we're putting on. Claire, the floor is yours.
Great. You can hear me okay?
Yes, we can.
All right, thank you everybody for staying on so long too, and thanks for having us. I'm Claire, I work with Stanford Healthcare's Patient Experience, Health Education, Engagement, and Promotion program. And we work with patients and families to just be the healthiest they can be. And we actually have a lot of free community offerings, so programs that are open to everybody in the community. You don't need to be a patient at Stanford to access them, and I wanted to talk to you all about them today. So the first is our Stanford Caregiver Center. For those of you who can't see, there's just a picture of a woman relaxing on this slide. This Caregiver Center opened in our new hospital last year. It's closed right now because of COVID, but it's a space that provides connection, guidance, and respite to caregivers. And it's staffed by staff, volunteers, and trained caregiver coaches that are all experienced caregivers and are there to offer you support, information, and resources. And they work with our Stanford Health Library. So they provide access to community resources and health information. And they're very empathetic, and they're available by phone right now during COVID. You can call 650-497-7100 to talk to a caregiver coach, or email caregiver@stanfordhealthcare.org. And they also have a page on our Stanford Health Library website, which I'll share with you in a second. Next is our palliative care health education program. This, we're trying to raise awareness in our community about what exactly palliative care is, because it's a little misunderstood. It's often associated with hospice, but it's actually available to everybody who has a serious illness like cancer, congestive heart failure, to give you extra support. So we're providing free virtual webinars about palliative care, advanced care planning workshops to the public. Right on this slide, you can see some pictures of our flyers, event flyers. If you want to see some event recordings from the ones we've done in the past, you can go to our website, which is at med.stanford.edu/palliative-care. And our next one's going to be about managing pain when living with cancer. It's going to be live translated into Spanish and Mandarin, and we're partnering with a number of really great community-based organizations on it. So check out our webpage to learn more about palliative care and how it could support you or your caregivers that are dealing with serious illness. And next is our Stanford Health Library. This is our longest standing program that's been around for over 40 years. It is available to everybody in the community. Like I said, you don't need to be getting care at Stanford to access our health librarians. During pre-COVID, we have a number of libraries in Palo Alto around our Stanford campus, as well as East Palo Alto and the Ravenswood Family Health Center, and in our Cancer Center in San Jose in the South Bay. And our librarians help you do research, access resources, many multilingual resources. We have a lot of community lecture series. There's just a ton of information. Like I said, right now the libraries are closed, but if you go to healthlibrary.stanford.edu, you can fill out an online form requesting health information you'd like librarians to help you with, and they'll get back to you with an informational packet and can just talk with you more by phone too. So check out our library. And lastly, we have Stanford Supportive Care Programs. So these are programs available to everyone in the community that has cancer or neurological diseases and their caregivers. And on this slide are just some icons of people doing yoga and eating healthy food or connecting by the internet, because we're all virtual now with our programs. But we offer exercise classes like Tai Chi and yoga, which are super popular right now, workshops, virtual support groups, and the coolest thing is you get a one-on-one nurse consultation, and the nurse will So
Claire,
right now you can call. Oh,
Claire, we lost you for just a second. Could you repeat that last sentence?
Oh yes. You can get exercise classes. Can you hear me now?
Yes.
Okay. Exercise classes, workshops, support groups, and one-on-one nurse consultations. So if you call the number, a nurse will talk to you, understand your situation, and then kind of tell you which workshops might work best for you. So the phone number is 650-721-8500. For those living with cancer, you can email cancersupportivecare@stanfordhealthcare.org. And for neurological diseases, it's nscp@stanfordhealthcare.org. I know I'm talking really fast because I want to get to the next one. Thank you all for your attention.
Claire, that was fantastic. How long have all those resources have been around? For a while, haven't they?
Health Library's been there forever. Our palliative care one's new, and Stanford Caregiver Center is new, and then the supportive care programs have been around a couple of years.
I remember the library from going through cancer treatments with a loved one of mine. Yet another amazing resource we are so lucky to have in this community. Claire, thanks for joining us this morning, and thanks for all those great resources.
You're welcome. Thank you.
I'm going to turn it right over to Ann with Peninsula Family Service. Ann, thanks for being with us. Thanks for hanging around all morning. We still have around 100 participants. And so, Ann, I see Or did I jump the queue? I think maybe oh, there we are. Peninsula Family Service. I see your presentation on the screen.
Great. Actually, we don't need those slides to the end, but that's okay. I'm really happy to be here today, and I'll try to go through this quickly. I'm the manager of the Senior Peer Counseling Program at Peninsula Family Service, and we have been helping people who have been lonely and isolated through peer counseling for over 30 years in the county and since 2008 in our organization. We know that COVID-19, the pandemic, put our social lives on hold, leaving many of us at greater risk of loneliness. And feeling lonely and disconnected from others is also a sign that we need to take care of ourselves and seek companionship of others. And I really like this quote from Dr. Vivek Murthy, the 19th US Surgeon General, who just wrote a book about the healing power of social connection. And I think what he said was that loneliness is very common and extraordinarily common and extraordinarily consequential. And we know that there are great consequences to loneliness and isolation. We see it in increased visits to doctors, to ER rooms, in a greater risk of dementia, elevated risk for heart disease and stroke. But we also know that many older adults have been experiencing loneliness and isolation pre-pandemic. But I think many of us now, after sheltering in place as well as social distancing, have a better sense of what some older adults may have been experiencing for a very long time. In our peer counseling program, we want no one to have to face the challenges of aging alone. So we have specially trained volunteer counselors who provide weekly visits or phone calls now to adults 55 and older in San Mateo County to help manage transitions of life changes such as health concerns, mobility issues, caregiver needs, and grief. Many of the participants are experiencing depression, anxiety, loneliness, maybe loss of a loved one, and challenges in health or feelings of isolation. So we do our best to connect our participants with peer counselors based on similar perspective or experience and language or culture. And it's wonderful to see the matches. And what we see too is that the relationship between the peer counselor and the participant, the bond is beautiful, and it's as important for the peer counselor as it is for the participant. We have a partnership with the San Mateo County Pride Center and serve older adults who are LGBTQ. We have peer counselors who speak Spanish, Cantonese and Mandarin, Tagalog. We have now a counselor who speaks Farsi, and I think we will have someone who speaks Hindi and Vietnamese soon. So we also facilitate online and telephone support groups in a variety of languages, trying to keep people connected and develop a sense of community. We're offering a fall training starting in October, and it's free. Volunteers learn the skills they need to be good listeners, to be able to work with diverse cultures, and to be there for individuals who are going through grief, to be able to respond to depression and anxiety. Our volunteers are terrific, and we'd love anyone who's interested in being a volunteer to join us or give us a call on our website, on our phone, or check out our website if you're interested in receiving peer counseling or you want to make a referral for someone who might need peer counseling. And let's see, a couple other things. We expanded our older adult resource line in March to meet the needs of older adults who really felt that they had fewer choices when shelter in place came along. And we have served over 450 people in the information line, accessing food, which was one of the biggest issues, and other resources. And then in addition, our staff and peer counselors have made over 400 well-being calls to lonely, isolated people in the community many who were doing just fine when they could go to their senior center, when they could see their family, and all of a sudden there was no one to talk to. So we've got a variety of different things going on. Our Fair Oaks Adult Activity Center, we're giving out 30 grab-and-go lunches Monday through Friday, thanks to collaboration with the Veteran Senior Center in Redwood City. And we also provide $5 taxi rides for residents who are 70 and older in Brisbane, Colma, and Daly City to travel within those cities and also to go to South San Francisco, Kaiser Permanente. And then lastly, in addition, we are offering an educational opportunity for the community to engage in the current socio-political moment. Peninsula Family Service recently had a town hall for our personnel to enlighten us on Black history, to contextualize current events, and to deepen our understanding of racial injustice, to engender empathy. And it was an excellent town hall, and this will now be available to the community. It was on the previous slide, but as long as you have our website, you can go to it and look for Advancing Justice, Confronting Anti-Black Racism. It will be part of our Thought Leader series on October 1st on Zoom at 10 a.m. So thank you so much. I think you've seen both of our slides. You can find us at www.peninsulaFamilyService. Thank you.
And absolutely wonderful, wonderful presentation. Thank you so much for all of that information. Thank you for everything you do for our community. We appreciate it so much. We have reached the end of the presentations. We have a few of the presentations that will be posted on the website, sm-dj.com/healthfair. So you can check out even more presentations. There's a couple of videos on the website there. You can also see the PowerPoint slides for all of our presenters. I am going to wrap it up right now. We've reached the end. Thank you for coming to this health fair. The Daily Journal will produce more virtual events and will advertise them in the Daily Journal newspaper and website. In the meantime, you can count on the Daily Journal to provide great local news and health-related news. I want to thank all of our speakers. We had an excellent presentation by Bill Graham at Dignity Health. I appreciated getting to talk with you a little bit about healthy communities and what we all face. We learned information from amazing nonprofits like Kaminar, Actera, Anthem, the Center for Independent Living, SF Hep B Free, HIP Housing, Stanford, California Relay, Meraki Real Estate, Peninsula Family Service, and of course you can check out the Ombudsman video on the website. This health fair has been recorded. If you missed anything, you can watch it anytime by going to the website. Special thanks to all of the staff at the San Mateo Daily Journal for putting this together, especially Carrie. Carrie, thank you for being my partner in trying to host this. It was my privilege to work with you to do this. I see we still have our 75 attendees and 5 panelists. I want to thank all of you for participating this morning. It has been a pleasure, but we are not out of the woods yet. 2020 is not over. We are still facing the pandemic. We are still facing the economic conditions, the wildfires, the earthquakes, the tsunami, the locusts. 2020 is a year like no other. I want to say to all of you, hang in there. Mental health, as we said again and again today, is absolutely critical. Thank you to all of our social workers. Thank you to all our health workers. Be thankful for our health and our families. Together we can rise to meet this moment.